able to hear, and you know, when I go on the mission field, or even if I just go to work, I see many people who don't even have that basic privilege. Some might be halt or lame, they can't see, they can't hear, and this scripture really started to make me think of how am I taking care of my body? And when we started this course, and you know, took some numbers, and the numbers weren't looking good, this scripture is what really, you know, chained me into getting back to what I knew that I should be doing anyway. So that's the main thing I remember about that scripture. And then the rest of the lesson began to talk about the heart and what actually is a heart attack, the signs of a heart attack, which we'll go into a little bit more deeply. But why I think that's important is because the heart is a muscle. And as Sister Lorraine said, it's responsible for, you know, pumping blood through the body. So basically taking blood that's been used and it's deoxygenated, sending it to the lungs to be filled with fresh oxygen, and then the heart pumps that fresh oxygen to the rest of the body. And if the body's not getting freshly oxygenated blood, things won't work properly. Nutrients won't be delivered to cells, you know, a lot of systemic problems happen. But the heart in particular also is a muscle. You know, in Costa Rica we had to do a lot of physical labor, and your muscles get tired. And if you don't drink water, you don't feed yourself, your muscles give out. Right? Has anyone ever done some exercise and the muscles start burning and start to give out? Well, the heart is also a muscle. And if you don't feed it with nutrients and oxygen, it will also give out. And a heart attack is when blood supply to the heart is blocked or compromised in some way. And so then fresh blood and nutrients are not getting to the heart, which is doing all this work to keep your body functioning and circulate blood. And then what can happen is if there is a blockage, then no oxygen gets to the heart and part of the heart starts to die.
What are some of the things that can cause it to block?
One of the things that could cause it to block is the buildup of fatty deposits on the arteries. So eating a diet high in fats, saturated fats, eating a diet high in cholesterol could lead you to build up plaque. They call it atherosclerosis is actually the disease. And that could cause your arteries to get blocked or clogged. That will also cause your blood pressure to go up because now the heart has to pump harder to push the blood through this narrower opening. It's almost like when you crimp a hose. You know, you can slow down the flow of water by crimping your hose. It's the same thing with your arteries. And so when I started to learn about what actually is a heart attack, another thing that stood out from the lesson are, you know, the signs of a heart attack, but more importantly, how important it is to respond when the signs of a heart attack, you start to notice them. So two things that were really important were understanding what the signs were for a heart attack, but how important it was to respond quickly. And when you see these signs, you should be responding within a week.
An hour. Come on.
An hour, exactly, an hour. And to me, that was a bit of information that it's called the golden hour. When there's a trauma patient, it could be different trauma, but they call this the golden hour because it means if you get to this patient and you start to administer, you know, aid within an hour, they have a much higher chance of surviving. And when I read that, if you start to, you know, someone suffering from heart disease or heart attack, if you get to them and start treating them within an hour, their outcomes are a lot better.
Tell us, what are some of the warning signs for the heart attack?
Okay, so some of the warning signs, and most of them are similar for men and women, but then there are also some that are kind of specific to women. So some of the warning signs is discomfort in the center of the chest, which is interesting. That was something I learned, the center of the chest, not over here. I used to always think if you have pain right here, that's what it is. But it's the center of the chest.
You learned that on TV, right?
Yes, exactly.
The person holding your chest and down. Yeah. Okay.
So discomfort in one or both arms, the back and the neck, stiffness in the jaw, lightheadedness, dizziness, feelings of nausea, things that could all be confused with something else, which was interesting. Cold sweat and nausea. I said that. And and feeling sick to their stomach and lightheaded.
Tell us some for the women. What are some of the symptoms that women do feel?
They feel discomfort in the chest, but symptoms for women, they feel a lot of discomfort in the upper areas of their body. So arms, the jaw, the neck. They also have shortness of breath, cold sweat, lightheadedness.
What about the stomach?
And yes.
Feel nauseous as well.
One thing I learned about this as well is women are a lot less likely to respond to these signs. You know, that's one thing I learned in this class, which is interesting. They're much more likely to ignore that or kind of be in denial that these things are going on. So it's interesting because you don't realize sometimes when you treat people or you're even in the field, you're a medical missionary, this is something I can keep in mind. Oh, wait a minute, men and women may respond differently to certain things, and so you have to be mindful of that.
Very good.
Can I just respond? I mean, you know, I hear you say denial, but actually we have more hormonal issues and we react hormonally. So there are times when I'm going to feel nauseous that have nothing to do with heart attack.
Right.
And so if I'm not aware of that symptom and I have no other symptoms, I'm going to think that this is something else. Most likely my period is acting up or something to that effect.
And
So it's not really a denial.
Denial was an office word.
I know. Well, even when I read it, I was like, well, wait a minute. What was the sense got to be denial?
And you know, it's funny because we used to think as men were the ones who denied.
Yes.
Men were the ones who did not go to a doctor
Exactly.
for years, you know.
Still don't.
So to say that women, I kind of had a little thing with that.